You wake up in the morning and feel like you never really slept. There is a strange kind of tiredness in your body that does not go away, even after your morning coffee. Your hair is falling out. Your mood stays off for no clear reason. There is a mild ache in your bones and joints. And sometimes the weakness feels so real that even climbing a flight of stairs starts to feel difficult. So you tell yourself it is probably stress. Maybe you did not sleep well. Maybe the weather is changing. But the real reason may be something else. Your body may be trying to warn you again and again, and you keep ignoring the signs. Right now, many people are living through a silent health problem without even realizing it. A huge number of people are low in vitamin D. Many are also low in vitamin B12, sometimes at seriously low levels. And the most worrying part is that most people do not even know they are dealing with these deficiencies. They think constant fatigue is normal. Hair fall feels normal. Irritability feels normal. But none of this should be ignored. Think about it. Even people who live in sunny places can still end up with weak bones and low vitamin D. How does that happen? Then there is vitamin B12, a vitamin your body depends on for brain function, healthy nerves, and making red blood cells. Low B12 has become so common that many experts describe it as a silent problem because it can slowly affect your body from the inside without obvious warning at first. I am not here just to scare you. I want to share something small that can make a real difference. It is a 1-minute daily habit. It sounds simple, but it can help you pay attention to your energy, mood, skin, hair, and bone health in a much smarter way. But before we get to that habit, there are a few important things you need to understand. Without that basic understanding, even a good habit may not help as much as you hope. Let us start with vitamin D, because this is where one of the biggest misunderstandings begins. Most people are told to get some morning sunlight and everything will be fine. But that is not the full picture. Your skin needs UVB rays from the sun to make vitamin D, and those rays are usually strongest between 11 a.m. and 2 p.m. Morning sunlight can feel fresh and uplifting, and it may help your mood, but it may not support vitamin D production as much as people think. There is another important point here. People with darker skin tones generally have more melanin in their skin. Melanin helps protect the skin from sun damage, but it can also reduce how efficiently the skin makes vitamin D. That means someone with darker skin may need more sun exposure than someone with very fair skin to make a similar amount of vitamin D. So if a fair-skinned person gets enough in a shorter time, people with melanin-rich skin may need 2 or even 3 times longer. And then there is the way most of us live. Many people spend most of the day indoors, in offices, schools, cars, and homes. And when they do go outside, sunscreen and limited skin exposure can reduce how much vitamin D the body makes. Then they assume their body must be making enough. But in many cases, that is not what happens. For your skin to make a meaningful amount of vitamin D, a decent amount of skin usually needs direct sun exposure. If you are indoors most of the day, or only get brief sun on a small area of skin, your body may not get the chance it needs. That is why just stepping outside is not always enough. The timing matters, and so does the way you get that sunlight. A practical approach is to try getting midday sunlight a few times a week when possible. Around 11 a.m. to 2 p.m., with some skin exposed, can be more helpful than only relying on early morning sun. For many people, even 25 to 45 minutes a few days a week can make a difference, depending on skin tone, season, and location. The point is not just to be outdoors. The point is to get the right kind of sun in the right way. Now maybe you are thinking this sounds difficult. You have office hours, responsibilities, meetings, and no time to sit in the sun in the middle of the day. That is real life, and this is exactly why food matters too. There are foods that can support your vitamin D intake, and some of them are more useful than people realize. Egg yolk is one of them. Whole eggs can be a helpful source of vitamin D, especially the yolk. A lot of people throw the yolk away because they have been told to fear it, but that can be a mistake. If eggs work for your diet, do not ignore the most nutritious part, and if you do not eat eggs, mushrooms can be a very smart option. There is also a simple trick here. If you place mushrooms in direct sunlight for 30 to 40 minutes before cooking them, their vitamin D content can increase. Mushrooms, in their own way, respond to sunlight too. Then you can cook them and include them in a regular meal. Another strong source is fatty fish, such as salmon, mackerel, or sardines. If you eat fish 2 or 3 times a week, it can help support your vitamin D intake in a meaningful way. And when you buy milk, plant milk, breakfast cereal, or orange juice, it is worth checking whether the product is fortified. Fortified foods can help fill small nutritional gaps over time, especially when sunlight exposure is not enough. Now let us talk about vitamin B12 because this is where things often get even more serious. Vitamin B12 is found naturally mainly in animal-based foods like meat, fish, eggs, and dairy. So for people who follow a strict vegetarian diet, getting enough B12 from food alone can be more difficult. That is already a big concern. But here is the surprising part. Low B12 is not just a vegetarian problem. It is also very common in people who do eat meat, fish, and eggs. Why does that happen? One major reason may come from a habit that is common in many homes, drinking coffee or tea with meals, or immediately after eating. Many people finish a meal and reach for coffee right away. But this habit may interfere with how well the body absorbs certain nutrients. So even when your plate contains good food, your body may not be getting the full benefit you expect. The solution is simple. Try to keep tea and coffee at least 1 hour before a meal or 1 hour after a meal. That small gap can help your body focus on digestion and nutrient absorption first. It sounds like a tiny change, but small habits often have big effects when you follow them consistently. If you want your body to make better use of the B12 in your food, this is one habit worth taking seriously. Now let us talk about the foods that can help support B12 levels. If you eat non-vegetarian foods, one of the richest sources is liver. Even having it occasionally can help. Eggs can help too, especially when eaten regularly as part of a balanced diet. Fish is another strong option, and for many people it is easier to include 2 or 3 times a week. If you are vegetarian, it is harder, but not impossible. Some dairy foods, like yogurt, milk, cheese, and cottage cheese, can provide some B12. Fortified breakfast cereals may help too. These may be useful foods to include more regularly if they fit your routine. But there is one thing to understand clearly. Vegetarian sources usually provide smaller amounts. So if someone is fully vegetarian, or if symptoms are strong, a doctor may recommend a supplement. That decision should be based on testing and medical advice, not guesswork. There is also another everyday mistake that does not get enough attention, relying too heavily on convenience foods while assuming they cover all your nutrition. Packaged snacks, fast food, and highly processed meals can fill you up, but they do not always give your body the vitamins it needs. So if most of your routine depends on quick, convenient food, it is worth asking whether your body is getting real nutritional support, or just enough to get through the day. Now comes an important warning. Please do not start taking high-dose vitamin D supplements just because you saw a social media video or heard a quick health tip online. That can be risky. Vitamin D is fat-soluble, which means the body stores it. If you take too much for too long without actually needing it, it can build up in the body and create serious problems. In some cases, too much vitamin D can raise calcium levels in the blood and put stress on the kidneys. That is why high-dose supplementation should never be casual. So before starting any strong supplement plan, get tested. A blood test can show where your vitamin D and B12 levels actually stand. Ideally, you should know your numbers at least from time to time, especially if you have symptoms. Then, if supplementation is needed, a doctor can guide you on the right dose, the right timing, and how long you should continue. Do not try to guess your way through it. Your body deserves better than random advice. Now pause for a moment and think about what you learned today. You learned that morning sunlight may not be enough for vitamin D. You learned that people with more melanin may need more sun exposure. You learned that sunlight can increase the vitamin D content of mushrooms. You learned that tea or coffee too close to meals may work against B12 absorption. And you learned that relying too heavily on convenience foods can work against your nutrition. These are small things, but they matter more than most people realize. And now we come back to that 1-minute habit from the beginning. It is not a magic trick. It is simply this. Take 1 minute every day to check in with your health. Ask yourself, did I get enough sunlight today? What did I eat? Did I have coffee or tea right with my meal? How did I prepare my food? That 1 minute of awareness can change the way you care for your body. Vitamin D and B12 deficiency may look small at first, but over time they can affect your energy, your bones, your mood, your blood, and your overall health in very real ways. So do not brush these signs aside. Start paying attention now. Take your health seriously from today, because if you do not take care of your body, no one else can do that work for you. And if this message taught you something useful, share it with someone in your family who is always tired, losing hair, or feeling weak without knowing why. Sometimes one piece of information can make a real difference. If you want more useful videos like this, stay connected, keep learning, and keep taking care of yourself and the people you love. Your health is one of your greatest forms of wealth, and the right knowledge can protect it. Now, I have one strict instruction. Do not try to fix everything about your health starting tomorrow. If you try to change your sunlight, your diet, your habits, and everything else at once, you will feel overwhelmed, and most people quit within a few days. Real, lasting health comes from one small decision, repeated consistently until it becomes part of your daily life. So, pick just one thing from today. Maybe it's getting a little more sunlight at the right time. Maybe it's not drinking tea or coffee right with your meals. Or maybe it's simply paying attention to what your body has been trying to tell you. Which of these habits do you think you've been ignoring? Tell me in the comments. I read them. If this video helped you understand what your body might be going through, share it with someone in your family who is always tired, feeling weak, or dealing with hair loss without knowing why. And if you want more simple, honest health information like this, make sure you subscribe. Finally, remember, everything shared in this video is general information for awareness. It is not a replacement for your personal medical care. Always consult your doctor before making any major changes to your diet, supplements, or health routine. Your doctor is your partner in this journey. Take care of your body. It's been taking care of you every single day, even when you weren't paying attention.